Guys, there's a saying that goes like this. It's to finish off the peaky from Goiás. For those who get this expression, it means, man, there's no way, things are really bad. Look, this is the third video this week, man, for God's sake. Misdiagnosis of appendicitis at an urgent care center, again at an urgent care center, but in different places, ends in death and becomes a matter for investigation. My God, what's happening? I don't know. I think I should make a free course for those who really want to save lives here on YouTube. For free, do something here, I don't know. A big class on anatomy and abdominal semiology, man, so we can save lives. I don't even want to profit or make money from this, no. I just want people not to die from appendicitis. Man, it's ridiculous for someone to die from appendicitis because of a failed diagnosis, man. It failed. The person can die from appendicitis because he delayed going to the hospital. Not because he went once, twice, 3 times in the other video, man. It was 8 times and the person died. Guys, for God's sake, young people dying, appendicitis has become a villain. Now having appendicitis is like having a big problem. Let's read what's going on here. It's not even about liking this video. Just leave your comments because, man, I'm shocked. Seriously, I want to make a content video. But things like this come up, man. It's unbelievable. This is really basic, man. It's just not possible. It's basic, for God's sake. This is basic stuff. If you graduated in nursing or medicine, man, it's basic. Anatomy is basic, man. Let's read what's going on here. An urgent care center's misdiagnosis of appendicitis leads to a death and triggers an investigation. The death of the English teacher Clinton Crado, 43 years old. Man, young man. This is being investigated in San Jose do Rio Preto after a series of medical appointments. My God, the guy didn't die because he went there once and they got the diagnosis wrong. It was a series, man, for God's sake, man. The man visits urgent care repeatedly, but his appendicitis goes undiagnosed. According to the family, he went to the clinic 3 or 4 times with severe abdominal pain and was discharged with diagnoses considered mild. The other person's pain is less than mine, right? Let's think of it as gas, kidney colic, or constipation. In other words, he left there like this. Look, are you in pain? That could be gas, colic, or constipation. Constipation. You ask, when was the last time you pooped? When did you poop? Let's use the real words, man, you know? I want to say it straight. I don't even know if there will be vocabulary with terminology, right? Because the guy who can't diagnose appendicitis won't have any vocabulary to use a technical term for constipation. But let's go. When was the last time you pooped, sir? Because if you say evacuated, maybe the guy won't understand, right? Because he's not from the health field, he's an English teacher. Oh, I evacuated. My evacuation is normal. So, it's not constipation? Ask, or was it? He said he was constipated. Oh, you're constipated, man. So, if that's the problem, why did you discharge him? Put a big enema there. Look, we installed the enema. Nursing staff here, right? We can put a glycerin solution in there and, man, almost everything comes out, even what shouldn't, right? Even the electrolytes go away, so glycerin solution, if that's really the idea. Now you send a guy home with constipation, man. What kind of guilt is that, my brother? Come on. On the last attempt, already in critical condition, he was transferred to Santa Casa Hospital. There, the team found that the appendix had ruptured. Days ago. It had been some time, at least if it's in the plural, days ago. That's at least 2 days, right? For it to be plural, it has to be at least 2, because 1 is singular. Days ago, 2, 3, 4, how many? It's impossible to know. And people thought it was intestinal gas. Trapped, mano caraca. Where's the old test? Where's the rhomboid test? My God. I'm going to have to give one. I'm going to have to give a lesson here. I'm going to have to do a live about this here. It doesn't make sense, man. There. The team found that the appendix had ruptured days ago and the condition progressed to a generalized infection. Sepsis, right? And sepsis, septic shock, cardiac arrest, classic death from appendicitis, right? Appendicitis kills, appendicitis, sepsis, septic shock, cardiac arrest. Andre, only now I did the CLS, you did the cardiopulmonary resuscitation. It's the worst thing they taught you in your whole life about cardiopulmonary resuscitation because you resuscitate. The guy who could have been treated before reaching cardiac arrest, learning cardiopulmonary resuscitation proves to many people that they were trained for an almost irreversible situation. Cardiac arrest means the guy died and we're trying to bring him back. Go take an abdominal semiology course, see if a single living soul shows up for free. No one does. But for advanced cardiovascular life support, you fill a room of 8 people, right? 8 people per group, it's packed, each paying $1,500. It's better for me to have advanced cardiovascular life support on my resume to know how to do cardiopulmonary resuscitation than to look at a guy with an abdomen there, with appendicitis. Man, it's ridiculous how healthcare is, unfortunately, man. It's sad. The health department opened investigations to look into the conduct of the professionals, because it's not just one, right? And the widow filed a police report on suspicion of medical negligence. The case is already won, right? Obviously. The case raises an important warning about persistent abdominal pain and worsening after discharge. Another one, right? Another one, another patient went home for free with abdominal pain. Abdominal pain. Guys, look, if you're still here in this video and haven't left yet, write down 2 things. Chest pain and abdominal pain are very serious things. With chest pain, you should always think about a heart attack. The idea is to rule out a heart attack. That's why there are heart attack and chest pain protocols. If you haven't studied this, you need to study it. I teach this to my students, but not everyone is my student. There are a lot of people in Brazil, a lot of people who follow me, and only a few are my students. I can't take in many people just saying, study chest pain and abdominal pain, for God's sake. Chest pain is the first thing. You look for a heart attack. If you rule out a heart attack, you look for aortic dissection, pleuritis, possible pneumothorax. Of course, there has to be a context, but there's also spontaneous pneumothorax, which doesn't have a history of trauma, but happens in tall and thin patients. It can happen, so here's the thing. Study chest pain and abdominal pain, for God's sake. Abdominal pain, abdominal pain, abdominal pain, abdominal pain. Know where the organs are and whether they are in the front or in the back, anterior or posterior, because then you'll know what's posterior. I have the renal system. In the front, I have the digestive system, and the organ is attached to the digestive system. Man, it's so simple, but if you haven't really studied, it won't be simple. Help me. Help the people. I try to transform nursing in Brazil, but apparently now I'll have to transform more people who give the initial diagnosis, and I'm willing to do it. I just want to help. I'm not trying to sell any course to anyone. The intention here is even to do a live so we can figure out how we can do it without any tests, to reach a simple diagnostic hypothesis. I think that if you guys think this is a cool idea, I'll come back with some lives. On Tuesdays, we'll start making this a practical class. Here, you know, 0800 without paying anything. 0800 here, see? And obviously, I leave something exclusive for those who are members here on the channel. I'll think about it. Leave your comments. It's sad. It's ugly, man. There are a lot of people dying every day for nothing.